This is the treatment group video for Disinhibited social engagement disorder. I'm Dr. Danielle Hicks, and my client is Danny Olson, and he's a 5-year-old child. For our differential diagnosis, we had only one, which is disinhibited social engagement disorder. And the primary diagnostic features of this is experiences negligent care, deprivation of needs, or repeated changes in primary caregivers that results in disinhibited social interactions involving overly familiar behaviors or lack of discrimination regarding social safety. Now on to Danny's story. Again, he's a 5-year-old boy and he's being evaluated because of his inappropriate interactions with others. He is brought in by his aunt with whom he recently came to live. She is concerned that one day he will trust a stranger who has malevolent intentions and harm will come to him. Danny's willingness to walk up to people he doesn't know and behave in an overly familiar manner startled her the first time she witnessed it. He was overly affectionate with her, but since she was his aunt, it didn't concern her too much. But his behavior with unfamiliar others truly frightens her, and she felt it was important to nip this behavior in the bud as soon as possible. Danny's mother has had difficulty being a consistent and responsive parent to Danny. She was 16 at the time she became pregnant and gave birth to him. She wasn't even sure who his father was, and the fact that she was still in high school at the time, she didn't want Danny to interfere with her social life, so she constantly left him with her mother. Her mother never wanted her daughter to go through with the pregnancy, so she felt resentful when Danny was left in her care. Regardless of who he was left with, he was often left to his own devices, even at the young age of 2. When his mother turned 18, she left Danny with her mother while she went on a road trip with friends and never returned. Soon thereafter, Danny's grandmother became ill with cancer, and her already marginal care of Danny became downright neglectful. She passed away after battling cancer for 2 years. After his grandmother's passing, he was sent to live with his aunt, who was more than willing to care for him. She was pleased on his arrival to see how affectionate and loving he was with her, to the point where he was clingy. This behavior was not concerning to her, considering he had been abandoned by his mother and recently lost his grandmother. What did concern her was that Danny would walk up to strangers and take their hand or climb into a stranger's lap if he or she was sitting and hug them. There were also a couple times when she took him with her to the mall and he wandered off without checking back to make sure his aunt was still there. After a brief search, she would find him talking to strangers. These incidents scared her deeply, and she knew that something was not right with Danny, and it was beyond her understanding to know what to do, which has led her to seek help for Danny today. Now on to the multi-axial diagnosis. On axis 1, we have disinhibited social engagement disorder. On axis 2 and 3, we have none. On axis 4, we have negligent parenting, repeated changes in primary caregivers. On axis 5, we gave him a GAF of 65. There are 2 theoretical perspectives, behavioral perspective and family perspective. Under behavioral perspective, the client's symptoms may be the result of a faulty learning experience, is operant conditioning. The client's history of receiving negligent care from his mother and grandmother results in an intense need to connect with others. The client's overly familiar behavior towards strangers without regard of safety and appropriateness is positively reinforced because his approaching, interacting, and touching others is a satisfying experience. Under family perspective, the client's lack of family structure due to the neglectful and non-responsive parenting from his mother and grandmother could have contributed to his needs to reach out to strangers. This could lead the client to have knowledge of appropriate boundaries. This could lead the client to not have knowledge of appropriate boundaries with strangers. And that's it for this treatment group video.